Minoxidil has been the wonder drug, the panacea for female pattern hair loss for a long time, almost 3 decades. It is the most commonly recommended drug for female pattern hair loss, and studies show that it significantly increases total hair count, leading to fuller hair after 24 weeks of its usage. 2% Minoxidil has been found to be far effective at improving female pattern hair loss as compared to a placebo. On average, about 40% of women using 2% Minoxidil found a whopping increase in their hair growth. In 20% women, on the other hand, the hair growth was moderate, and in 40% of the remaining women, the hair growth was minimal. So what about these 40% in whom Minoxidil did not create a significant change in hair growth? Can we not give 5% Minoxidil to these ladies, even if it is an off-label usage? 2% Minoxidil solution was approved for men suffering from hair loss way back in 1988. And it was in 1992 that 2% Minoxidil solution was approved by US FDA for use in women suffering from female pattern hair loss. Later in 2006, 5% Minoxidil solution was approved for use in men. In 2014, only 5% Minoxidil foam was approved for usage in women. So if you talk about 5% Minoxidil solution, it is not approved by US FDA for use in women to treat their female pattern hair loss. And we all know that the solution form is far more effective than the foam. In a study which recruited 404 women suffering from hair loss, and who were given a daily application of 5% Minoxidil foam to treat their condition, experts found that 5% Minoxidil foam seemed to be better suited for promoting hair growth and increasing hair count. Also, 5% Minoxidil was found to be well tolerated by these women. Yet you often wonder why your doctor does not prescribe you 5% Minoxidil. Why does he only restrict the prescription to 2% Minoxidil? Is it because side effects in women increase by using 5% Minoxidil as compared to 2% Minoxidil or women's Rogaine? The truth of the matter may lie in the fact that 5% Minoxidil in the solution form is not yet approved for use in female pattern hair loss by the US FDA, and its usage continues to be treated as an off-label prescription for treating female pattern hair loss. In another study, 113 women were divided into 2 groups. One group of these 113 women was instructed to apply 5% Minoxidil foam once a day, while the other group was instructed to apply 2% Minoxidil twice a day. In spite of the lower application frequency, the group that applied 5% Minoxidil foam once a day, in this group it was found that 5% application once a day was as effective as when 2% Minoxidil was applied twice a day. To summarize, while both treatments may be effective for treating female pattern hair loss, the 5% Minoxidil formulation may be more effective for treating severe hair loss which is not affected by 2% Minoxidil, those 40% ladies who do not respond to 2% Minoxidil application. Minoxidil works for women the same way as it does for men, by dilating the skin blood vessels, increasing the supply of nutrients to the hair follicle, leading to fuller hair. We may not know the exact mechanism how Minoxidil improves hair thinning or maintains hair in a healthier state. But what we know is that Minoxidil increases the duration of the anagen phase, that is the growth cycle, and decreases the telogen phase. It increases the number of hair that are seen on the head at any given time. It makes the scalp look fuller. So what are the side effects? The side effects of Minoxidil which may worry us. The side effects due to which we may not like to prescribe a higher concentration in women, and we prefer to use only 2% formulation when we are treating female pattern hair loss as compared to male pattern hair loss. So the number one is Minoxidil causes scalp irritation. It can cause scalp itchiness, dryness, scaling, redness, and at times it can cause scalp allergy. It can worsen dandruff, it can worsen seborrheic dermatitis, or if you have psoriasis can flare up. And this is more true because of the alcoholic content of 5% solution. Allergic contact dermatitis has also been reported by the application of higher concentrations. Secondly, during the first few weeks or even months of the usage of Minoxidil, you will see increased hair shedding or telogen effluvium. This can be very worrisome for a female who's losing hair. Even though it improves after a couple of months, this can be nerve-wracking for a woman. Another possible side effect is the growth of unwanted hair on the forehead and also on the face. And more so it happens with the use of 5% higher concentration of Minoxidil. Due to an unknown reason, this doesn't happen in males. And studies have shown that from 3% to 50% of women applying Minoxidil report unwanted hair growth on the face. So this may be a large number, and this keeps us from prescribing 5% Minoxidil in women. And this hair growth is dose dependent. And there are women who notice a change in hair color and hair texture after Minoxidil. And women, as you know, are more sensitive than men. There is a small minority of patients who may complain of chest pain, dizziness, giddiness, fainting spells, unexplained weight gain, swelling of feet and hands after using Minoxidil. So while you're using Minoxidil, weigh yourself every other day. A weight gain of about 2 to 3 pounds, that's 1 kilogram, has often been reported after starting Minoxidil. Though over a period of months, this settles down, this may be worrisome in the initial few months of its usage. Lastly, if you're pregnant, you should avoid using Minoxidil. Traces of Minoxidil are known to pass into the newborn child through breast milk. So even breastfeeding women should not use Minoxidil. In a study conducted in the United States, it was found that 5% Minoxidil was significantly superior to the application of 2% Minoxidil and also the placebo in terms of change from baseline in vellus hair count, patient rating of scalp coverage and treatment benefit, and also investigator rating of scalp coverage. To summarize in the end, as I see it, women are not prescribed 5% Minoxidil because women react differently to Minoxidil solution, and they do not need the same concentration of Minoxidil as men do to regrow their hair. Since they are more sensitive to Minoxidil solution and often experience better hair growth using Minoxidil even in a lesser concentration as compared to men. Therefore, doctors like me would rather walk the tightrope and prescribe lesser concentration of Minoxidil to avoid side effects in women by using 5% Minoxidil, by rather using 2% Minoxidil. 5% Minoxidil in my clinic is reserved only for women who are not responding to 2% Minoxidil. Those 40% women who do not respond to 2% Minoxidil, or women who are suffering from severe hair fall. Also, 5% Minoxidil in women is not yet approved by the US FDA. Well, thank you for watching. If you have any question related to female pattern hair loss or about hair loss in general, its treatment or hair transplant, do not forget to leave a comment in the comment section below and I'll get back to you. Thank you for watching again, and God bless you.